is a professor at the Clinic of Emergency Medicine at the University Hospital of North Norway. He worked and trained junior doctors at Al-Shifa Hospital in Gaza for the past 2 decades, and he now joins me live from Oslo. Thank you so much, Doctor, for being with us on the program. Now, it's great that in theory they've agreed to allow more aid in, but the process of the aid actually getting into Gaza is a lot more complicated than it's made to seem, with Israel inspecting and denying much of the aid that has already been brought to the Rafah crossing so far. You're very well aware of how Israel operates, given the time that you've spent in Gaza. What are your thoughts on the latest developments?
No, I totally agree with your correspondent. It was a brilliant sum up. This is a propaganda show. It has nothing to do with really solving the fundamental problem. There are two fundamental problems in Gaza now. It's the ongoing military attacks and the bombing and the destruction of healthcare. And it is, on the other side, the complete siege of Gaza, which has been going on for 16, 17 years, and the only trickle of supplies that are being allowed in by the Israeli occupation forces. Both of these problems can be easily solved by political means. Number one, a lasting ceasefire and a withdrawal of the Israeli occupation forces from Gaza. And number two, to completely open Gaza to humanitarian support through all the gates that were described in the south, along the eastern fence and in Erez. This should have been done a month ago. So it is, this propaganda show. The United States is sickening in its double standards because they have the leverage and they could have solved this huge humanitarian disaster, which is really a disgrace for humanity, with some very few political tools. They could have said stop with the weapon supply and stop with the money supply to Israel, and we would have saved thousands and thousands of lives. So as a medical doctor, I know that prevention is better than cure. And the only preventive measure now, it is to stop the military killing, the industrial killing by the Israeli occupation forces, and it is immediately to open Gaza for the free flow of what is already waiting at Rafah and has been waiting at Rafah for months to get in. I mean, this is a systematic killing machine and a starvation machine that is currently have already killed more than 23,000 children and women. We know that there are almost 30 children who have starved to death. And we know from the last UN report of yesterday that there are more than 50,000 children in northern Gaza risking acute starvation. So this is a man-made, massive medical and political disaster, which the only key is held by the United States and by EU.
From a medical perspective, Doctor, how much aid is needed to stabilize at least the health of most of Gaza's population now?
There are three fundamental problems now. It's food, it's water, and it is the treatment of sort of basic medical conditions. Dr. Youssef Abarish, the brilliant Minister of Health in Gaza, the Palestinian, he said already 2 months ago, he said that the triangle of death in Gaza now, it is starvation, dehydration, lack of water, and diseases. That accounts for more death, avoidable death, than the bombing itself. So how much help is needed? I don't think anybody knows, but a WHO representative said the other day that the long columns of trucks waiting at Rafah, if they could be allowed into to Gaza, it would be enough food for the people. And they can process 40 trucks an hour. So all this theater play about the external help and the boats coming in and all that, Israel now opening Erez, it's only another show to make Israel and the United States look good. In fact, there is a massive need for food, water, and medical supplies. The Palestinian healthcare system could be repaired and reopened under Palestinian leadership very quickly. That needs to be done, and more relief teams must be allowed in.
I'm glad you mentioned the healthcare system because you were talking about the treatment of the wounded in Gaza, which should be of top priority at the moment. But it's really tough to see that happen in the near future, given the destruction that we recently saw in Al-Shifa, which accounts to 1/3 of Gaza's healthcare system. You worked in Al-Shifa. What's your analysis of where it was prior to October 7 and to where it is now?
Well, it's a complete 100% destruction. Shifa cannot be used in its current situation. It has been completely destroyed by the Israeli governmental forces. It's a historical low in human history that a governmental army supported by one of the world superpowers has been allowed to destroy the flagship hospital with 700 beds, all specialties, university hospital, important training and teaching institution in Gaza, to just level it completely through bombing, burning, and killing, not at least killing the brave health workers, the patients, their relatives, and the refugees. Shifa cannot be used anymore. It has to be rebuilt. And I talked to Dr. Sobiskeik the other day, who was the manager of Shifa through many years, a brilliant doctor. He said, yes, they have destroyed it, but we will rebuild it. And that's the spirit of Gaza. And that's what we need to support now. We need much more concrete solidarity. And I urge your president, Mr. Erdogan, please, can you put focus on the cancer care in Gaza? I've been working at the Turkish Friendship Hospital the last 3 years together with Palestinian doctors because we wanted to install radiation therapy for cancer patients in Gaza. In fact, we were going to put the spade in the earth in October when this happened. But the Turkish Friendship Hospital was another flagship hospital for the cancer patients.
Right.
As your reporter said, now 10,000 cancer patients are without any treatment in Gaza because of all these attacks on healthcare. And you have the leverage to end that, the Turkish government.
All right. Dr. Mads Gilbert, thank you so much for being with us here on the NewsHour and giving us your time. I appreciate it.
Thank you so much.